So, good morning, everyone. It is the first webinar of the year, so I have to say it even though it's near end of January. Happy New Year. So thank you for joining the SPOR and XCVMPD status update webinar. We will now start. Before we do, please note that this session is being live streamed and will be recorded and made available through the EMA corporate website and EMA YouTube channel. You can interact with us at any point of the meeting through the interaction tool Slido. Interaction with Slido is voluntary, and you may, of course, opt to remain anonymous. If you choose to use your Slido details, you are hereby consenting to the processing of your personal data. Next slide, please. So as mentioned, this is the Slido code that you can use to interact with us. Please provide your questions and comments in Slido only, and please send and upvote the questions you want to hear answered. I have been looking at Slido already, and we haven't even started, and we already have a lot of questions there. We will have dedicated points for Q&A in the session today, and we will verbally address the top voted questions. Now, please note that the session is broken down into different topics. We will address the questions only for that given topic. So if we're discussing substances, we won't be addressing XCVMPD questions. Also, as mentioned, there might be a high volume of questions, and also we're a bit pressed for time. So it's inevitable that there will be unanswered questions. We do apologize, but we simply cannot go through all. So please look what other colleagues may have entered already and vote them, as this increases the likelihood for those questions to be addressed. After today, we will look at the questions, and the most relevant one, the most representative, something we haven't covered, they will be added to our FAQ documents. And in certain cases, we may ask you to contact service desk if it's case specific or we need more details to understand the question. So today's presentation will be available in the SPOR portal document section and the event webpage. The recordings will be available at EMA YouTube channel and also at the events webpage. We will be focusing, as normal, to provide a brief update on the activities on SMS, OMS, RMS, XCVMPD, and today, for the first time, also PMS. And we will be focusing mostly on recent and planned activities in the previous quarter and the following quarter, and trying to highlight impact to users. And this results from feedback from yourselves on our customer satisfaction survey that you wanted more frequent and targeted information. As mentioned, so now I'm doing this little housekeeping notes, brief introduction of the session. I will be providing a little context of how these pieces interconnect, how SPOR XCVMPD interconnects with other processes. Then we will have a little piece for each domain, starting with SMS, OMS, RMS, XCVMPD, as I mentioned, first time PMS. Each of the sessions is 10 minutes, and it has its own dedicated Q&A. So please, in the session for SMS, try to highlight the questions for SMS and not starting to add questions on OMS, XCVMPD, and other topics, as it really hinders our selection of the questions to be addressed. So if you have questions on a subsequent topic, we do appreciate if you can hold on to them until the topic is being presented, because it's easier for us to target which questions to address. Now, starting with the first overview of how SPOR, XCVMPD, PMS all fit together. SMS, OMS, and RMS have been in place for a couple of years, actually, and most regulatory processes throughout the product lifecycle are already using data from SPOR. So if you see at the top, we have the entire product lifecycle from scientific advice, clinical trials, approval of products, pharmacovigilance, and so on. And you have an indication of which type of data from the SPOR domains is being used across all of those different business processes. If, on the other hand, you're more interested on the specific systems that the network has, whether it's CITES, whether it's IRIS, whether it's UPD, UDRA GMDP. At the bottom, you have a table that lists the different systems from the network, and at the end, the different SPOR data that it's being used by those systems. And as you can see, it is already a very comprehensive footprint. So the relevance of this is that what we do today and what we will announce today in SPOR updates has a knock-on effect on all these different business processes and on these different systems. So that's why the webinar and the activities in SPOR matter to all of the processes. Next slide, please. Now, specifically to what we're doing in products, it's important to note that what is registered in SMS, OMS, RMS, and how data is mapped affects what industry will see in XCV-MPD and PMS, and also all those other solutions that I mentioned, IRIS, EAF, PUI, ESMP, and so on. If we have an incorrect organization, you might not be able to see the product if the mapping is not correct. So there are some impacts that we keep repeating and making sure that you are aware and that you can mitigate them. In terms of flow, industry should request substance, terms, organizations well ahead any application, whether it's an electronic application form or apply for a manufacturing authorization or submit data to UPD, even also before submitting data to XCV-MPD. With regards to product data is entered firstly in XCV-MPD and shared already with clinical trials and pharmacovigilance systems. Then it flows to PMS, to IRIS, PLM portal, and all those other systems. And if product data needs to be corrected because it's showing wrong in IRIS or PLM portal or any of those systems, the system where that data needs to be entered is still XCV-MPD. So it's important to note, again, what we do on XCV-MPD has ripple effects on all these downstream systems. And of course, industry and NCAs do interact with product data that has been entered in SOR as well as XCV-MPD. Next slide, please. So focusing on what we'll cover today. So we're doing these quarterly update webinars. Substances, organizations, referentials, and XCV-MPD, they're already full-fledged data services as such. So we will be covering on activities on data management, how we process the data, what data quality activities we're doing to improve the quality of the data that we manage, how do we support the customers with customer services and service desk. We will talk just briefly in terms of small IT maintenance improvements because we don't have active development going on. And that's the focus of these SPOR quarterly status update webinars. Most of the activities on product management, as I mentioned, are happening in XCV-MPD. So where we manage the data, where we manage the quality of the data, and also most of the customer service desk support are providing on XCV-MPD. Today, we're bringing a little bit of update on PMS. You will see a lot of activities on PMS on the Agile ceremonies, on the quarterly demos that are happening under the Agile IT delivery. And today we will cover a little bit on customer services, which is the only operational support we are actively providing on PMS. And we'll also keep you up to date with the ongoing status activities, so a brief overview of what's happening in PMS. On the other hand, what we will not cover in detail is how the data is used in all these consuming systems, how you should use the SPOR data in EAF and UPD and so on. If you do have those questions, we may try to address them in writing if we have capacity, but that's not the focus of what we will be presenting today in the webinar. So we're focusing on what we do, SMS, RMS, OMS, and mostly XCV-MPD, and a little bit of an update on PMS to give you context of why we're asking some activities to be undertaken. So before we pass on to the different domains, and today I mentioned we will be focusing on what we did last quarter and what we plan to do this quarter to give you an update. I thought it's only fitting that we start the year with a little recap of what we did last year. So do bear with us. We have a little slide show to share. It's only a couple of minutes and I would like to leave you to it. So Marcos. Thank you. I hope that was a quick recap of what happened in 24, in case you had forgotten during Christmas break. Uh, um, According to the agenda, there was supposed to be a few general questions now about how all these things fit together. I quickly zapped through Slido, and I understand most of the questions that we have at the moment are very domain specific. How do you do things in XCVMPD? How do you do things in OMS? So unless you have a few dedicated overview questions, please put them now that we can cover. I'll give you a minute to write any overview questions. So now is the time to ask questions. How do things connect together? If you have a question. No, I don't see questions coming in. So I'm sure we will have more questions on other parts of the presentation. That's fine. So I propose we now move on to SMS. So please focus and try to listen to the presentation that Pedro will do and ask questions on SMS so we can filter them out. There will be still an opportunity at the end to revisit any part that you may still have lingering questions. So now over to Pedro.
Okay. Thank you. Good morning, everyone. My name is Pedro Batista. I'm the SMS business lead, and I'll be giving a brief update on our activities on SMS. So, as you can see, in terms of data management activities, we will continue with the usual data enrichment exercises, addressing your change requests and your questions. So this will continue to go on normally through the year. In terms of data quality, another continuous task is the further development of data quality profiles to maintain and improve data quality in SMS. And as new activities, we have the revision of the critical medicines custom attribute and data cleansing of additional substance types, starting with herbals, fungi, and animals, so organisms as a whole and as part. And then next, the human vaccines. And later in the year, we will start addressing homeopathic substances, and we will try to address finally the duplicates with SVG flag 0. In terms of documentation, we released last quarter a new version of the SMS guidance, and through the year, we'll be publishing additional updates. And in terms of data modernization, this year we'll have knowledge transfer to a new IT supplier. So the activities that we had planned for this year, such as improving the substance exports, will be a bit delayed through the year. Next slide, please. Thank you. So as I've just mentioned, there was a new list of critical medicines published by the European Commission. We have analyzed the changes in this list, and there were new ATC codes and related substances added, and we added the attribute critical medicines to these substances. And likewise, some ATC codes were removed from the list, so we have removed this custom attribute from the related substances. I would like to remind you that this custom attribute and any custom attribute in SMS is only available to you via the SMS API. And in terms of benefits, this supports several use cases such as shortages, e-prescriptions, and eventually in the future, the generation of a global substance ID. Then in terms of the guidance for external users, so version 2.0 has been published, and the main changes in this version is related to access to the SMS API, There's also a lot of new information regarding data cleansing and the different scenarios and impacts for you, and also data quality monitoring. Next slide, please. In terms of next activities, as I've mentioned, we'll be addressing organisms, so plants, fungi, and animals. Our internal pre-cleansing is almost completed, and we will start soon the discussions with the SVG, and then this cleansing will be implemented in SMS. And these substances, they serve as parent substances for homeopathic substances and herbal extracts. So while there's not many products directly linked to these substances, they are an important stepping stone for future substances that are used in many products. Then this year we will also be focusing in human vaccines. SVG is working very hard on this. We will prioritize first the human vaccines that are related to critical medicines, and afterwards the remaining human vaccines used in other approved products. And this year, for the SMS guidance, we are also changing the approach slightly. So we will try to do more frequent updates with less sections per update. So instead of taking 1 year to create a major version, we'll try to do more frequent updates, just targeting one section. And the next section that will be addressed will be business rules. And lastly, I've mentioned already the knowledge transfer. So we have a new supplier for development, and we need to prioritize this. So the changes that we had planned for Q1 will have to be done a bit later in the year. Next slide, please. So to summarize, we have published a new version of the guidance, and we revised the custom attribute critical medicines based on the new list published. We are currently working on a new version of the guidance with the business rules and cleansing all the organisms. Then we'll be focusing on human vaccines and start future versions of the guidance, namely on confidentiality. And lastly, we will start with the homeopathics and address the duplicates that have SVG flag 0. So that was it for SMS. We will now go to some questions. So first question, we heard last year about the upcoming EMA release of guidance of substance domination in databases, and can see in SMS planned activity slides, SMS guidance version 2.0 published in Q4, which will be subject of updates in 2025. Can you clarify if same? I'm not sure if I understand this question, but as I've mentioned, a new version of the guidance was published last year. So we have version 2.0. You can access it in the SPOR portal in the SMS tab. We are currently working on 2.1 that will include business rules. And then later through the year, we'll be providing further updates of minor versions addressing additional sections. Then next question, when EMA will start nullify SVG flag 0 substances in SMS. So several of these substances have already been nullified, and we started the ones that were not used in products, were not linked to ICSRs or any procedures, so very legacy substances that were actually not being used by anything. Now the ones that are remaining are the ones that are linked to many products, or they are linked to many ICSRs. So they have a big impact in almost all systems. And now we also have PMS that we need to consider. So that's why in the timelines that I presented, they are later in the year because we still need to do more assessment, and once the timelines are more defined, then we will communicate them in advance. So we will not nullify more substances until we make a proper plan and communicate it. Then water is registered in our dossier as an excipient, but it's later evaporated from the manufacturing process. Therefore, should we still add water to SMS? If it is in the SMPC in section 6.1 as an excipient, then yes. Otherwise, it would not be added in the product. So the substance already exists in SMS. It's just a question, should it be used in a specific product or not?
Pedro, maybe here, because I think the question is if it's in SMS, water is already in SMS as a substance. Maybe the question is if they should submit this information to XCVMPD. Then the answer would be, well, if it's in the SMPC or in Module 3, depending on the document that you are going to provide, then yes, you need to include it. Otherwise, there is no need. But the substance in SMS is already there.
Okay, thank you, Marcos. Where should I find the SMS guidance? It is not under the SPOR webpage. So if you go to the SPOR portal, you click on the tab Substances, then there will be a hyperlink to the SMS guidance there. Yeah, SPOR portal. How do you manage UCML?
Union list of critical medicines.
Yeah, okay. The union list of critical medicines in SMS when only some forms are part of the list. So we have analyzed all the ATC codes that were included in the list, the related substances from those ATC codes, and then we map that information to SMS. You've marked some substances with SVG flag 0 as a duplicate that is also marked with SVG flag 0, unspecified, for example, OPA-dry. What to do in such cases? So this scenario is not very common, but it does happen for some substances because OPA-dry just by itself, without any additional information, is not a specific substance. So there's hundreds or thousands of different OPA-dries, and the correct OPA-dry should be used instead of this general one. If that information is available in the SMPC, well, then it's easier. If it's not in the SMPC, then you can either keep referring to the unspecified OPA-dry, or you can refer to the specific one according to Module 3. Do you anticipate any involvement of industry in vaccines cleansing activity with the SVG? Not for the moment. At a later stage, it might be a possibility if there's any additional information that might be required in USRS. However, the current focus is to cleanse the substance names in SMS. That only needs to be done with public information. So the information that industry might be required or will be helpful to provide would be more for USRS, but that information is confidential, so we cannot include that information in SMS, and it would be in USRS only. Will allergens be covered within plants, fungi, animals? If not, when will cleansing start? So allergens will be related to these organisms that we are cleansing now. So it's not just the homeopathics and herbal extracts that will benefit from this cleansing. The allergens will also be cleansed, but they will not be cleanse at this stage, so it will come at a later stage. Substance details in SMS required based on substance use, for example, a pediatric investigation plan application. Are you planning to improve guidance for applicants in this regard? We experienced some issues with this process. So this is related to confidentiality, I think. So for the purpose of pediatric investigation plan, you cannot use a substance with a company code as a preferred term, and instead a common name or a systematic name must be used. This information is already in the guidance in SMS in the section confidentiality. It will indeed be improved through this year, but these main principles are already detailed there, and they are also mentioned in the substance request form. Do you foresee cleaning up the substance translations in SMS? Do the translations really required? Translations are required, yes. So if a translation is not available in SMS in a specific language, then it should be requested. In terms of cleansing, this activity is not being prioritized at the moment, so we are focusing on the names in English. At a later stage, this might be considered, but it would likely require involvement of NCAs to validate their respective national languages. We are actually working with one NCA already on this task, but it is not a priority at the moment. And I think last question, will there be any specific guidance for vaccine cleansing in SMS? If yes, for what time is it planned? So like I've mentioned, so human vaccines are a priority for this year. And once the business rules are agreed with the SVG, then the guidance will be updated with the business rules, not only for human vaccines, but also for veterinary vaccines.
So I'm keeping an eye on Slido. There's lots and lots of questions on XEVMPD. I don't think I've noticed anything left on SMS. We can, of course, circle back. Another reminder, I see a lot of similar questions on XEVMPD on Module 3 on composition. Please bear with us. We will elaborate on that when we're explaining XEVMPD. And it's a bit more efficient than answering to the same question a couple of times. So now I hand over to Deborah, who will take us through OMS.
Thank you, Isabel. So my name is Deborah Braga. I'm currently the OMS business lead, and I will guide you through the OMS bid. So starting with customer service, we continue supporting our users through ServiceNow. And yet again, at the end of the year, we aim to do our yearly review of our FAQs and knowledge articles that we've published in ServiceNow based on our FAQs. In terms of data management, so we just yesterday we published the new and improved OMS data protection notice. Why improved? So what we did is we included the registration process for natural persons. We in this OMS data protection notice, you can find the scope of this registration, because it's not going to be acceptable to all regulatory process. We've established the same. And the step-by-step is not going to be through change request as our OMS users are used to. There's going to be a dedicated process, exactly because of the personal data. But we will. I'll show you a bit more in the next slide. This year, you've heard about the OMS currency check. This is something that we used to do every 2 years to records that have not been updated in the past 2 years. But we've noticed that this process had some flaws, and the flaw was that at the end we actually had a handful of records that we were not looking at them every 2 years, but every year we were reviewing it. And in order to improve this, because there is no need to look through a record that has not been updated for 1 year, what we're going to do is we will change the currency of this process from from yearly to monthly. We aim to start this at the end of Q1. We continue supporting with the mappings for EDQM and ERA. We will later to the year will pick up the review of the enrichment on the German National Business Registry number. In terms of data quality, we continue. It's an ongoing process, improving our data quality profiles, and we will continue also with the work on the review our legal entity types according to what is established country by country. So this is an activity that is not trivial. We're now under the assessment where we are going to capture volumes for further assess on next steps. In terms of documentation, we would like to share with you a significant improvement that we did on the data quality standards. I'll show you, but just what we did is no more than review the events. This is under one of the annexes of this document. I will guide you through this activity in the next slide. Later on the year, there's still some documents that we would like to update. One of them being the category descriptions that we have that has not been updated for some time. So as part of our ongoing process improvement, we would like to review some of these documents. In terms of awareness, is the same that Pedro just showed you. So OMS will participate in the same events. In terms of information management and what we did in terms of IT systems, so OMS recently did anonymization of our change request details. I will show you exactly what happened and the reason why this happened. Right now, we're going over a knowledge transfer to a new IT supplier. This will take some of our time and resources, and IT development may be paused for some time for the upcoming months. Next slide, please. Thank you. So taking back to what we were talking, natural person registration. For those that have participated in previous webinars, this has been an activity that we have been waiting for some time. Now we're finally there. We finally concluded this. We're now starting the registration of individuals or natural persons that are not registered with the National Business Registry. So these are natural persons that are required to they have an active role either on UPD, that need to issue another GMDP certificate, or that are a marketing authorization holder in EV. These are the three scopes where this registration will be allowed. Of course, we don't expect to increase the number of registrations because, as I mentioned, this is a very small niche of companies, organizations that still that we were waiting to be able to register in OMS. Another activity that we are performing, which is that we just concluded, which was to improve the Annex 3 of OMS data quality standards. This was part of an ongoing and continuous review of old documentation. It was a document that has not been updated for some time, an annex that has not been updated. So we try to enrich with the real world business scenarios, and at this end reflect what those real scenarios would impact based on the OMS processes and business rules. With this, we help to increase the transparency on OMS processes to make it more clear on event basis. Another activity that we concluded last quarter was the IDD anonymization. So we did this because OMS processing happens, the data processing happens outside EAA. So due to the new data protection regulation, so this we had to do to hide, to anonymize certain elements to our change request process. We're talking about username, the name of the person, the email, the phone number. These are elements that when someone creates a change request in OMS, they will be captured and visible to all data. They used to be visible to all data stewards. They are now just visible to a very small niche of data. So majority of them will not see this information anymore, and this helps us ensure the compliance with the user's data protection rights, since the personal information is not visible to most of our data stewards. Next slide, please. What's next? So for the next months, we're kind of pausing or delaying some of our IT developments, and this is happening because of the knowledge transfer to the new IT suppliers. This happens because of the normal procurement cycles there was the need to renew the contract. And the focus now is to do this knowledge transfer, and later on we'll come back to the deployment of our features. Next slide. And some of those features that we still need to develop, to highlight the OMS return change request feature. This is very close to an end, but there's still some work to be done. The version reason that you've seen in past webinar, and this is a business activity, but it's an ongoing activity, the review of legal entities. In the future, continue with the documentation, like I mentioned already, an IT feature to come, OMS portal. There will be some changes and upgrade and improve the user experience. And I think with this we can move to some of the questions. Should I? Okay. It is planned in the foreseeable future that organizations are informed when their entries in OMS are altered. So we have in our backlog to develop a subscription feature, just like RMS has. But unfortunately, it's an activity that, due to other prioritizations, we have not been able to implement. It's in our backlog. We just have not visibility on when we will be able to implement it.
But to be fair, we've always said the volume of changes in OMS is very high, and we strongly recommend companies to invest in using the SPOR API. So if you use the SPOR/OMS API, you can be informed, you can be aware of daily changes, of hourly changes as frequently as you want. So we really recommend companies to invest in integrating with the SPOR API. We host every year a SPOR API webinar. There's videos available, and if you have questions on how to integrate, we're happy to support you using our service desk.
Thank you. So OMS, why are a number of location ID inactive in the last months? So we didn't perform any special activity that would lead to a significant number of deactivations, but and these inactivations of locations, they happen mostly via change requests. So if a certain location has been deactivated, most likely it's because someone from the company told us that that physical location is no longer active to that organization. What we've noticed indeed is a significant number of change service desk tickets asking the same questions, but please remember that OMS, when a physical an organization is no longer using a certain physical location, this data should be inactivated. We cannot reactivate a location because they're still using it, for example, in XCV If the location is no longer active, it will have to remain inactivated. How can I demonstrate the existence of my company if not registered? So in our OMS portal, we have our guidance on the change request process. Depending on the type of organization that we're talking about, we've established which supporting documentation you need to submit. Okay, in the same and in the same line. For example, if it's a natural person that is that it has an active role in one of those three scopes that I just told you, there's also a new process defined for this. But it will depend on the type of organizations we're talking about. I would advise you to please consult this OMS change request document. There is a very detailed table depending on the type of changes, depending on where the organization is located, and you will be able to see which type of supporting documentation will be required. It can also happen that is outside the domain, that is a record that doesn't need to be registered in OMS, and for that reason we may reject. But if you have a particular case, please reach out to us with the organization name and where you want to use this data via ServiceNow, and we'll be happy to help you with the registration process. Is data of organization overwritten when synchronizing OMS with the national address database? How can we assure, as owner of the organization data, that the data is correct according to the reference of proof of registration? So this is you need to remember that OMS aims to provide a standardized list of organization and location data. Indeed, OMS uses the proof of registration to validate an organization and its respective locations. But when we talk about standardization of the location, most of those registration documents, they have no standards. They use the data as the user is used to have the information. OMS uses local standards to ensure a good quality of the data. So it's possible that there may be some slight differences, some enrichments performed by OMS, but OMS always says that we never create a copy from the supporting documentation because we are a standardized list of data. I hope this address what it means with natural person registration in OMS. No, it does not include EU QQPV. The only EV registration that includes it's when we have a natural person acting as a marketing authorization holder. A natural person is someone that is not registered with the National Business Registry as a company. A natural person can be someone that is registered with the local authorities as an entrepreneur, We have, for example, the case of the Polish National Business Registry Entrepreneurs Database. So these are not natural person because the Polish Entrepreneur Registration Database is public. We're talking about people, entrepreneurs that may be registered in entrepreneur database of a certain country jurisdiction, but because it's not public, we cannot validate. That's why we've created a dedicated process only for other GMDP when a certificate needs to be issued, EV mark when these people are acting as marketing authorization holders, not KQPV. KQPV is not part of the scope. And when we have a marketing authorization holder for UPD. These are the only exceptions. So moving on, OMS, are there any deadline for marketing in regarding to OMS? I'm not sure I understand, but
No, we don't have any deadline, any specific activity for companies with regards to OMS. Just tell us if the company name, locations need to be updated.
thank you. Yeah. A vendor who is contracted out to several marketing authorization holders make a change to their manufacturing site and address. They can make a change, correct? Yes. Who's responsible is to change this data in OMS. So OMS data is a public entity. Anyone can submit a change request. We will validate the accuracy of the data. The vendor or the applicant, as I just said, anyone can do it as long as the data is accurate. The first one to spot it that the data is not correct should submit a change request to us.
Maybe just to summarize, so as Deborah repeated, anyone can submit a change request. We don't define who should. We tend to see that it's normally in the applicant's best interest, and they're a little bit more diligent to submit those change requests because they need to have the information up to date for their applications. But that's not to say that the applicant can have an agreement or a contract with the manufacturer or anybody who works for them and ask them to submit those change requests. So we leave it to the companies to organize themselves. Anybody can submit as long as they have the documentation. And what we do tend to see, it is normally the applicant who is a little bit more diligent or has the most pressing interest to have the information up to date for their applications. And I see there's still some OMS questions, but just judging from the volume, there's a lot more XCVMPD questions. So apologies for that. Deborah will still be answering some in writing. Yeah. So I suggest we do this last one and then we move on.
Okay. Should I register pharmaceutical company as a commercial sponsor for clinical trials for the first time in SPOR only or in XCVMPD as well?
Maybe I'll take this one.
Okay,
So
thank you.
if you need to submit a development medicinal product, so unauthorized medicinal product in the XCVMPD, then you also need to reference a sponsor in that DMP entry. So therefore, you need to submit the sponsor information in the XCVMPD as well.
And before you do, you need to ensure that that organization exists in OMS. So it all starts in OMS, really. You need to have the sponsor in OMS so that you have access to XCVMPD. And when you have access to XCVMPD, then you reuse the same information, you put the OMS code. But you have to have the organization first in OMS, otherwise you won't even have access to XCVMPD. And now we will hand over to Jaume with an update on RMS. As mentioned, we will be trying to close some of the questions in writing. Please put now questions for RMS so that we can star them for addressing verbally.
Thank you, Isabel. Good morning, everyone. My name is Jaume Gonzalez. I'm the business lead for RMS, and I'll give you a a quick summary of what's going on with RMS and what is planned for the next quarters. So going in chronological order from left to right and going by quarters. In terms of customer services, in the last quarter of 2024, we provided support to users regarding the mappings that are between XCV-MPD and RMS, which are needed for PMS implementation. And this is planned to continue throughout the next few quarters. And we also increased our activities in the areas of quality control and quality assurance. In the area of data quality, we uploaded additional Medra translations, and I'll provide details on this later. In terms of documentation, we continued the review of several list information documents for a few key lists. And again, I'll provide details on this later. In terms of stakeholder management, webinars, etc., probably will not repeat as it's the same as my colleagues mentioned. And in the area of modernization, we implemented the anonymization in MDM and IDD, as my colleague Deborah mentioned earlier. And again, I will touch on it in the next slide. Now, for the first quarter of 2025, so the present quarter, additional topics that I would like to touch upon are the review of the manufacturing activity list, which is currently ongoing, and the focus for the moment is on the short terms and the descriptions. We are also planning to update the ATC human and ATC vet lists with the 2025 versions, as well as the Medra list. And we are also planning to publish the medical device nomenclature list from the European Commission. Something else that we are working on are the creation and update of data quality profiles, and also the update of some data quality reports, which are looking at aspects such as the completion or improvement of term descriptions and the assignment of current terms to terms that are non-current. And then in the area of modernization, and similarly to what's happening with OMS, we are starting the knowledge transfer to the new IT supplier. For the second quarter of 2025, we are planning to review and update the units of measurement list, as well as the Medra and Vedra lists. And we will trigger consultations with subject matter experts with the aim of reviewing the special precautions for storage list, the shelf life list, and the material list. In the area of modernization, we are planning to implement a new functionality to allow users to see previous versions of RMS terms via the API. And we're also planning to upgrade the RMS portal, which should come with some improvements as well. And for Q3 2025, we are planning to create a process to be able to do bulk updates for updating the medical device list. And we are also planning to implement the integration of the RMS API with the Medra API, which would allow us to pretty much have live synchronization of this list. If I can have the next slide, please. So going into more detail for what happened in Q4 2024, as mentioned, we added Medra translations for additional 10 languages. And so examples of these languages are Greek, Estonian, Korean, Latvian, Polish, Swedish, Finnish, but there's more. And these languages, basically, they were missing in RMS because there was development needed. So what happened last quarter is that there were some changes made in the Medra upload process in RMS, so that going forward, all of these languages will also be uploaded in the RMS database in future updates. As a result of this, we are having an increased coverage of translations in the Medra list, and we are hoping that this could lead to a higher number of users or an increased consumption of the list. The second topic from the previous quarter is the anonymization of MDM and IDD that my colleague Deborah mentioned. So basically, RMS data processing is performed outside the EEA, and precisely to comply with these data protection rules, there were fields of data, of personal data such as name, username, email, phone number, etc., which had to be anonymized. So this anonymization took place in the last quarter through the creation of a new data steward role that cannot see this personal data. And with this change, we're now in full compliance with the user's data protection rights and freedoms. If I can move to the next slide, please. So here I would like to show what is planned for the present quarter, so Q1 2025. So as mentioned, we are currently working on the review of the manufacturing activity list, and this is taking place as we speak. The focus, as mentioned earlier, is on short terms and description, as these are needed for PMS implementation. The way that this review is taking place is through the consultation with a multidisciplinary group of experts that was created late 2024. This group meets approximately every 6 months to discuss this list. The current review is about to be finished in the next few days, and we expect the revised version of this list to be published by the end of this month. The expectation is that thanks to these descriptions, users will be in a better position to distinguish terms in a better way. And also the display, the short names should simplify how these terms are displayed in systems such as PMS and EAF. So hopefully this should reduce the number of queries that we'll receive around this topic. And it should also reduce the number of errors when submitting information related to these manufacturing activities. The next topic is the review of the list information document. So you're probably aware that this document might be missing for some of the lists in RMS, and some of the lists in RMS do have this document, but it may be outdated, so it needs to be updated. So the plan for this quarter is to either create or update around 14 lists. I'm not going to go through them, but you can see the ones that have been identified for the moment. And the benefit of this exercise is that there should be improved guidance on each one of these lists, and this would hopefully also reduce the number of change requests rejected for these lists, and it should also increase awareness amongst users. Last but not least, and due to procurement cycles and to the new framework contract in place, we are currently doing the knowledge transfer to the new IT supplier. So as it was mentioned earlier, the IT maintenance and support in the RMS area, it will be temporarily put on hold, and the focus will be on this knowledge transfer. So the impact is that some IT capabilities that were planned for this quarter will now be delayed to either the second or the third quarter of this year. Next slide, please. So as a summary, and if we focus on the highlights that are important for users, so what changed in the last quarter of last year was the anonymization of the data in the MDM and IDD modules and the upload of new translations. Ongoing work is the review of the manufacturing activity list. the work on the data quality profiles, the review of several list information documents, and the knowledge transfer to the new IT supplier. What is planned for the next quarter is the consultation with subject matter experts to review the key lists which are the special precautions for storage, shelf life, target species, and material list, the functionality to be able to see previous versions of RMS terms through the API, and the upgrade of the RMS portal, which will come with improvements. And changes planned for later in the year will be the integration between the RMS API and the Medra API. And here it actually mentions publication of EMDM list. That's actually for Q1 this year. And what's really planned for later in the year is the creation of a bulk upload process for the future reviews of the medical device list. So that's all for the presentation. I'm not sure now if there are any questions on RMS. Okay, so in the latest version, chapter 2, the name of the medical device type RMS list was stated as European medical device nomenclature. When will SPOR display this list? So the plan is to have the list published in this first quarter of 2025. Okay, looking at planned RMS activities, Q2, kickoff review of special precautions for storage of live material, plus optional DCID enrichment in 25. I'm not too sure what this DCID enrichment is. Should industry expect EMA opening PMS data enrichment for packaged item?
Yeah, maybe I can take this one. So no, for the moment, we don't have any plan to request any additional enrichment. We will have discussions, which is the next set of data that we will require. But for the moment, we don't have any additional information to provide. It's only focused for the moment on manufacturers and these data carrier identifiers. But there is no additional plan for the moment. Whenever we know more, we will let you know.
And just to add on that, the reason it's listed as an RMS activity is because we will consult subject matter experts and the key user group. Yes, there was a question on the key user group. It's pretty much an active group to understand what needs, what terms, and to see if there's any proactive work we can do to prepare the list ahead of a PMS implementation. But there's no concrete plans yet to ask industry to submit that information. Just analysis work, investigation, making sure that we improve the list a little bit ahead of PMS implementation and for the purpose of EAF and other systems who may use the list as well.
Thank you, colleagues. So a search for functionality in the respective list will be very helpful beside the full search already available. Is there anything in planning? So there is nothing planned on this area as far as I'm aware. Indeed, the search that we currently have is well, it can be actually across all lists or across individual lists, but not within each one of the lists. So if a user needs to be kind of in-depth searches, what my recommendation would be to actually export the list, perhaps in Excel, and perhaps do searches from there.
But just to say, the question to me hints a little bit that the users may not be familiar with the advanced search capability. So there's a simple search that you type a name and it does indeed look at that name across all the lists. But if you click on the tab Advanced Search, you can select to search and select the list, and the search will focus just on that list. And you can search a given name or a given attribute. There's a few more parameters there. And that's already quite extensive, we believe. In any case, as Jaime mentioned, if still that's not sufficient, the best way is the good old export to Excel, and then you can find your heart's content in that Excel export.
Correct. And as Isabel said, the advanced search, it will be it's dynamic. So if you search for a specific list, it might give you the option to filter by attributes that are specific to your needs. So still, if this is not enough, feel free to send us a direct query and we can look into the specific problem that you might have. Our company's registered dosage form is not in the RMS list. Can we request for this to be added into the RMS? Thank you. Indeed, please submit a change request to the RMS portal, and we will handle with this. So dosage form, it's owned by EDQM. So most probably, if if the request is if the term is really needed, we will then liaise with EDQM on your behalf. So please do submit a change request for this.
Maybe just a note on this one. So if we're talking of new products that you're about to register and you have a dosage form that it's missing, yes, by all means do a change request. But if you're talking about a dosage form that you have in a product that you submitted already in XEVMPD and somehow you don't see that dosage form in the RMS list, this could be for another reason. In the SPOR portal, there's a mapping file, and we did a lot of effort to map the terms from XEVMPD to recommended terms in RMS. Some things are typos, are misspells, some things, particularly the combined dose form terms, you would find an equivalent there, but in a slightly different order of the terms. So we don't create every variant of the registered dose form. We select the most suitable one. And during that exercise, we also consulted EDQM for a few of those terms. So please, we do recommend that you look at those mappings. There might be a reason why you won't find the term. You can, of course, submit the change request, but we will reject it. So in case that happens, it is because we've already looked at the term, we've already mapped it, and have already identified the recommended option.
Thank you, Isabel. How could we be notified for any RMS list change impacting our products? So for changes in RMS, the advice is to use the subscription functionality. So basically, as registered users, you are able to specify which are the lists for which you would like to be notified of changes. And you can subscribe to either one or several lists, and you can also specify if you want to be notified only on major changes or both major and minor changes. Yeah, I think that's it. So this one, why the non-current authorized pharmaceutical form are migrated in PMS as part of the AMP data. The proposal terms are not available. What should we do?
Yeah, maybe I can also take this one. So when we do the mapping, when we did the mapping between XEVMPD and RMS in order to migrate the data to PMS, we had to take into account the non-current pharmaceutical dose forms and also some non-current terms from RMS for the legacy products, because some of those legacy products were using terms that are not current terms in RMS. So in order to do this migration, we took into account these non-current terms, and that's why you can see those in PMS. We have not taken into account the proposed terms. I guess these proposal terms are related to the proposed terms. So that is the reason. You can also see the mappings in RMS. If you go to the mapping section, you can see, okay, this authorize those form or this, I don't know, ATC code, any term is mapped to an RMS term, and you can see those mappings there. But that is the reason why we used the non-current terms in PMS.
Thank you very much, Marcos. So just as a reminder, the document that Isabel was also referring to earlier with the mappings between XEVMPD and RMS, they are under the document area within RMS. So you basically need to navigate to RMS, documents, and then you go to the general tab, and they are the documents starting with D. So you have D1, D2, D3. Those are the data mapping. Those are the mappings for several lists. So you can find it there.
So I don't see any more pressing changes on RMS. I do see a lot of questions on XEVMPD. So please bear with us. We already have more than enough questions than actually we can cover in the allotted time. So I don't want to put you off, but know that we will not have time to go through the hundreds of questions that we have. Be very selective of what you vote and you want to see updated next. So without further ado, I hand over to Marcos and Veronica. I think it's Veronica first.
Good morning, everyone. I will provide a brief update related to the XEVMPD activities. With regards to Q4 2024 and XEVMPD customer services, we have been performing our support to stakeholders as usual. From Q1, however, of this year, we will be reviewing the services that we are provided through the service desk and as part of the AMP validation. This is in response to the suggestions we received as part of the survey, which was sent to you in Q4 last year. With regards to XEVMPD data management and services, in Q4, we have been performing a revision and also improvements of the current AMP validation process. This is also linked to the validation of AMPs in clusters. We have mentioned information about these activities in the last webinar, which we had in October. And again, from Q1 of this year, we are going to be performing validation of composition in AMPs, so authorized medicinal products, based on the information available in Module 3. I will be providing more details on this in the later slide. Also, we have been providing mapping services to national competent authorities. Again, more information is coming. In terms of XEVMPD and data quality, in Q4, we started the data quality review to support PMS migration. This includes several activities. QPPVs are being contacted with regards to the data in XEVMPD, which is then migrated to PMS. Again, more information was provided in the webinar last year, and this is something that is ongoing and will continue at least until the end of this year. In terms of the activity, which is happening from Q1. If you have read the updated version of Chapter 3.2, you may have noticed that we are implementing a change in the way that a former marketing authorization holder should notify a transfer of marketing authorization to another organization registered in EudraVigilance under a separate headquarter. So this is something that you need to take a note of from January 2025. I will provide more details shortly. In terms of XEVMPD documentation, we have revised and updated Chapter 3.2, so the guidance documents for marketing authorization holders, and also the relevant Q&A document. I am aware that we have published the document only at the beginning of January. Please, if you haven't seen it yet, I would urge you to go through the document, have a look at the summary of changes, and refer to the changes that are described. Again, I will be providing further information about these changes included very shortly. And in terms of XEVMPD awareness and visibility, we did have the SPOR update webinar week in October last year. We also ran the SPOR customer satisfaction survey. And with regards to this year, we are also having a SPOR webinar today, and there will be another one in the next quarters with the PMS Info Day also taking place in Q2 2025. And last but not least, how we modernize data and information management. Well, I have also informed you in October 2024 that we have started the review of the current XEVMPD user interface to see if there is a possible technical upgrade that we could maybe implement in terms of bringing this user interface up to date. I will provide further information very shortly. And as you know, from Q1 2025, we have implemented a new authorization value for the pending national authorization in XEVMPD. Again, further information will be provided shortly. So in terms of the work completed, just a few highlights to you. So with regards to the XEVMPD and PMS mapping services, which we provide to NCAs, why are we doing it? It is to support national competent authorities in their readiness for mapping of national product data against the data that is currently available in PMS. So far, if I remember correctly, we had 8 national competent authorities that requested this support. We have started to hold webinars with national competent authorities from October 2024, and this will continue until the end of 2025, so this year. What is the impact and benefit? National competent authorities will be able to map the products in their national databases to the data in PMS. Also, with regards to the ESMP reporting, this will be possible thanks to this mapping, and we are also increasing the transparency of product data mapping efforts performed by EMA and national competent authorities. As I've previously mentioned, at the beginning of this month, we have published revised versions of Chapter 3.2 and the Article 57 Q&A document. Why? Mainly to reflect the latest information and also changes in some of the key processes or guidance that we provided to date. These are related to the identification of the authorized medicinal product entries for France. As you may remember, the guidance used to be that you should reference the NL number. As this is a confidential number, we have actually been asked by the French National Competent Authority to advise users to provide the CIS number, which covers all the pack sizes, or the SIP number, which is assigned to each individual pack size as the marketing authorization number to be referenced in the medicinal product entry. With regards to the new marketing authorization status value for pending MRPs and DCP, the guidance is also provided in Chapter 3.2. We have had a few questions on this. I believe we will touch upon this during the Q&A session. However, some information on how to use this value when it should be referenced is also available in the document. And last but not least, the transfer of marketing authorization process change has been also referenced in that document. As I mentioned, the new versions of the documents were published on 10th of January. And why have we made these changes? It is to make sure that the products are available in PMS or the consuming systems, and they reference not only the correct information, but also are available for the correct MAH specifically in PMS, and this is related to the transfer of MA process change. Last but not least, the work completed. So, as I mentioned before, in Q4 2024, we have started the assessment to determine if the XEVMPD user interface could be accessed without the need for ActiveX and the IETAP extension, and also if it could be used in other supported web browsers, not just the Internet Explorer and Chrome. With the IETAP, I am very pleased to inform you that we have identified a possible solution. We are currently still assessing the details for the implementation to make sure that the user interface will have the same look and feel as the current user interface. Therefore, there is no need to retrain everybody. There is no complicated setup involved, etc. What will be the benefit is that you will be able to access the interface more easily. It will be a browser-based solution, and there should be no need for ActiveX or IETAP in other supported browsers. Next slide, please. What's coming next? As announced previously, I believe during PMS webinar, but also as now mentioned in Chapter 3.2, we will be validating the composition of substance information as per Module 3 information if the marketing authorization holder chooses to reference in the authorized medicinal product entry in the XEVMPD the composition as it is entered in Module 3 dossier. So at the moment, marketing authorization holders provide the composition of the medicinal product based on information in the SMPC. we are now also saying that you can provide the composition as it is referenced in Module 3, specifically in Section 3 to P1, I believe. If you do that, we would like to ask you to make sure that you reference the composition of all the substances as per Module 3, and you also attach to that product entry in XCVMPD the extract from Module 3 dossier. This will support the validation of the product information, which means that as a benefit to you, you will not be contacted by the validation team and asked to provide further information, either for a missing document, or just clarify why some of the information related to the substance or substance strength is not as it is referenced in the SMPC. With regards to the implementation of MA transfer process change notification, why are we doing it? Well, in PMS, the nationally authorized product data will now contain confidential data such as manufacturers, and therefore we need to make sure that the information that the former MAH will let us know who is the new MAH of the transferred product. Since the access to the data as such is still managed through XCVMPD. So what is changing? The former marketing authorization holder will now, as part of the invalidation of the authorized medicinal product entry, also have to reference as the marketing authorization holder the new marketing authorization holder in the product entry that is being invalidated. This will then let us know that the MAH, the former MAH, is okay with the transfer of the medicinal product data in PMS to the new marketing authorization holder. So the impact is that we will empower the marketing authorization holders to control the data and access to their product data in PMS. And we will also have enriched data in PMS and that is kept after the MAH is changed due to the transfer of MA. And last but not least, with regards to the implementation of the new valid pending national phase marketing authorization status in the XCVMPD, this was developed to support submissions of MRPs and DCPs approved in the reference member state, but still under evaluation in the concerned member states in the XCVMPD. The new value is available in the production environment from 15th of January and can be used by marketing authorization holders as per the rules which are also set out in Chapter 3.2. So this is not valid for national authorizations which are pending. This is only for MRPs and DCPs. And the benefit is that pending MRPs and DCPs will be migrated to PMS and available in the web-based variation form to be used by applicants, so in EAF. Next slide, please. Couple of highlights for you. Please take note of the amendment in the process to notify the transfer of marketing authorizations for marketing authorization holders which are registered in EudraVigilance under 2 separate headquarters. Also, you have the possibility now to report AMP composition in the XCVMPD as it is stated in Module 3 dossier. Please note that it's either as it is stated in Module 3 dossier or as it is stated in SMPC. Please do not mix and match information from both reference sources. Also, the new valid pending national phase MA status is implemented in XCVMPD and can be used in XCVMPD. And just a very quick reminder, please note that Windsor Framework is in force from January 2025. This means that in XCVMPD, the authorized medicinal product entry referencing EU as the country of authorization no longer includes Northern Ireland. Therefore, if the marketing authorization holder of a product, which is a product approved under the centralized procedure in the EU or EEA, wishes to have that medicinal product also approved in the United Kingdom, you have to apply for a marketing authorization through the MHRA via a national procedure. In terms of ongoing work, as I mentioned before, we are working on improvements on the validation processes of authorized medicinal products to facilitate a faster validation, and we also now group in records belonging to the same products for new authorized medicinal products. We call this the cluster validation. We are providing mapping services to national competent authorities, and we are continuing our review of the current xCVMPD interface and the technical upgrade. With regards to future changes, we will be working on improvement on validation process for authorized medicinal products, for updated authorized medicinal products, so not just for the new ones, but also for updated. And what's coming much later is that we will be trying to integrate product validation with the review of substances with SVG flag 0. Thank you very much. Let's go to the questions. To support the formula harmonization in xCVMPD, the M3 is requested. What section of M3 is expected and how to deal with confidentiality of the document? So the section is, Marcos, remind me, 32P1.
Yes, 32P1.
Sorry, our family said it a few times today. The section is 32P1, and please bear in mind that attachments that are referenced in authorized medicinal product entry are only viewed by the company that submitted the attachment and therefore owns the attachment, so by you, but also the EMA. Nobody else can see attachments. The next question, will you extend the expiration date to submit pack size on xCVMPD with the relevant package description? I think, Marcos, this is related to the
yeah, so the date is, so for the union, the products that are under the union list of critical medicines and that you already have in xCVMPD, you have still a week and a half to submit this information. But you need to maintain this product, so if you have not done it yet, please submit this information because it is required for ESMP. You need to maintain this information, so it's not that you need to submit it by the 31st of January and then you stop. That means that new products that are that you get approved and that are under the union list of critical medicines, you need to keep submitting this information to xCVMPD. So it's not a one thing process. You need to keep maintaining also this information.
Maybe a few heads up on that. So we've discussed with shortages colleagues, and indeed the intention still remains that we need to collect all of the packages for the products in the union list of critical medicines by February. We will, to give you a little bit of a heads up, do a little bit of an analysis to know how far we are and whether we've received those packages. So if the figures don't add up, expect contacts via trade associations and such, because we are undermining the public case and the mitigation of shortages. So please, all the packages in xCVMPD by the deadline of February, and this has not changed. In addition to that, we have asked that for the packages that you have created in xCVMPD, you have until December to go and complete the structured package details. And that would be in the PUI or PMS API. So this is a two-stage thing, and that deadline still remains until December. For the GTIN that we see here on screen, that is optional. So we will open the possibility for companies to enter their data carrier information. That is optional, but the value of that is that we plan to have some pilots with electronic product information throughout the year. And of course, we will be looking at products that have the data carrier information and that have the EPI. So that's why we are recommending, if you can, please include the GTINs, particularly where we already have EPIs, so that we can demonstrate the value and the link of that information in the real world. So deadlines have not changed. All packages in xCVMPD by Feb, all package structure details and manufacturers by December, and GTIN still optional but recommended particularly for the products with electronic product information.
The next one, since Module 3 information is confidential, an extract from the dossier requires a screenshot of the data to be submitted. Is that correct? Yes. Well, screenshot, we'd like to have a readable extract. So an extract, PDF extract would be perfect. The strength information in module 3 should be hidden. No, because we need to validate the strength of the active substance if you have referenced it in the AMP entry as per module 3 with the information in module 3. So please do not hide the strength information. Can you please clarify if the new authorization status is to be used only for new marketing authorizations or for all variations for MRP DCBs?
Okay, so I have seen a lot of questions regarding this new authorization status. We have implemented this new authorization status to support a specific use case on the web-based application form. And this specific use case is when the marketing authorization holder has to submit a variation for a product that has been authorized in the reference member state, but where it is still under the evaluation on the concerned member states. So only if you need to submit a variation using the web-based application form in this scenario, then you need to submit those pending products in XCVMPD. If you are going to use the PDF application form, you don't need to do it because you can just include the information in the PDF. So it's a very specific use case. If you already have a product like this, you can submit the pending products in XCVMPD, and you will be able to see them in the variation form. I hope that clarifies all the questions that we have received regarding this this topic. It's for this specific use case. It's the same use case as submission of homeopathics. If you need to use the web-based variation form for these products, then you need to have them in XCVMPD, even though they are the submission of these homeopathic products is not mandatory. It's just for a specific use case.
Thank you, Marcos. Next one. Should we report products previously approved in Northern Ireland under the central loss procedure, but transition to the MHR national procedure post-January 25 as new XI EV codes? The guidance is not clear. Yes, if the marketing authorization of these products is valid in Northern Ireland, then we would see the products entered in the XCVMPD under the Article 57.2 requirements, therefore referenced in one of the EU national procedures, and then the marketing authorization status. If there's a difference in excipient name between SMPC and Module 3, which takes the precedence for XCVMPD submissions? So it depends on you. If you submit the substance information in the XCVMPD as per Module 3, then you need to attach Module 3 extract. If you submit information, or if you wish to submit information as it is in SMPC, you reference the SMPC. You need to choose yourself whether you submit the shellac as the active ingredient or excipient as per the SMPC, or shellac glaze as it is stated in Module 3, and then attach the reference document.
Maybe just to add here, like Marco said before, the data in XCVMPD is used for different purposes. If you are about to submit a variation and use the data for an electronic application form, you may want to align your composition with Module 3 so that there's no questions. But we're in no way recommending that you now replace all the compositions with Module 3. So what we're giving you is the option. If you don't need it, leave it as at the SMPC. If you want to update the composition, please do so, and then align the entire composition with Module 3. What we request is that you send us the means to verify that information. So if it's with SMPC, you send us the SMPC. If it's Module 3, we need that attachment so that we can verify. So for us, critical is we need a reference source to validate the information we're receiving. We leave up to you which source of truth you want to use, either the SMPC or Module 3. We're not recommending companies to go and all of a sudden update all the compositions of all their products into Module 3. You can if you want to, but we're not asking you to do it. We give to you the choice to align that as and when you need to submit any application and you see a benefit in aligning that composition.
Okay, the next question. It is stated in the XCVMPD guidance that the MAH acquires the AMP from a different company. He needs to provide its MAH details, code name and address to allow the former MAH to add it to the invalidated product. Yes, so you need to know, as a former MAH, you need to know who you're transferring your authorized medicinal product to. You can either find the information in the XCVMPD lookup list, so in the marketing authorization holder lookup list, or if you're unsure, in case the MAH has got multiple EV codes, which should not really happen. However, sometimes we do have cases like that. You need to check with the new MAH what is the correct EV code of their MAH organization in the XCVMPD, so you can reference this EV code in the product entry that you are invalidating. Can you clarify the relationships and reuse of the IDs that are expected to be provided per pack sizes? National ID per pack size in XCVMPD package description or data carrier ID in PMS packaging? Couldn't these be aligned?
So the thing is, these two IDs are used for different purposes. So the first one, the national ID that we are requiring in the package description, is mainly used for two things. One thing is for you to be able to identify the specific pack size and that you are able to map and recognize, okay, this is my pack size for the 10 tablets with this national ID. And also it's used, and it's going to be used by NCAs to map the data that we have in PMS to their national databases. So it's mainly for you to identify a specific package and for NCAs to be able to map. Then the data carrier that we have, that we will require in PMS, is to support the connection between PMS and the EPI. So these are two different use cases. Also, the data is submitted at two different levels. So that's why we are requiring this different information. So the alignment, well, it's two different IDs for two different purposes. We have no plan for the moment to link both of them. But of course, each pack size will have both the national ID on the package description and then the data carrier also in PMS.
Thank you, Marcos. I am working for the first time on a development medicinal product not authorized yet. I'm qualified for the management of the XCVMPD for authorized medicinal products. Do I need to take the XCVMPD exam for the development medicine? Well, the exam, or more precisely, the notification that you receive after you've taken the exam is required during the organization's registration with EudraVigilance. So if you are working for a sponsor which is already registered with EudraVigilance for medicinal product reporting, we will not be requiring a notification. Therefore, you do not need to take the exam. You can just submit the development medicinal product information as per the standards and guidance that is provided in the guidance documents for sponsors. What are the timelines for submitting CIS-SIP numbers for NAPs in France instead of MA numbers? I believe there is no defined timeline as such. However, Marcos will clarify.
We don't have a timeline. The thing is, we have received this request from the French NCA, so we really recommend marketing authorization holders to replace the NL number if they have it in XCVMPD, because it shouldn't be reflected in XCVMPD or in PMS or in any database, because in principle it's a confidential number. So that's why you should change these numbers. You can do it with your normal maintenance of the products, but if you foresee that some products are not going to be like updated in a long time, please go submit the update and change these numbers. But there is no strict deadline like by the end of next month or something like this. We have not received this request, but please do it because it's a requirement that we have received from the French NCA. Then the next one is for valid pending national phase records, what documents to be used as supporting documents as the SMPC? We don't have it approved. Also, the data fields like the full presentation name, package description to be provided in local language. So here I would like to apologize. It's been my fault that we have not included this information in chapter 3.2, but we are going to update it. Also, we will update the XCVMPD Q&A document to provide all this information. You need to provide the SMPC of the reference member state, or if you have the SMPC that the concerned member state is going to evaluate, you can include this document so we can use it. In principle, we are not going to validate the data of these products until the status is changed to valid. But yeah, you can provide this information in this SMPC. But we will again update this information as soon as possible so you have everything in the documents.
Thank you, Marcos. In case of MA transfer, when the current MAH is replaced by a new MAH, which specific field should be updated in the XCVMPD system to reflect this change during the invalidation of the old MAH? So during the invalidation of the product, not the old MAH, so of the product that was submitted in the XCVMPD by the old MAH, the old MAH is supposed to reference a not valid due to MA transfer marketing authorization status and also invalidated date. That's always been the process. Now, as a new information, you will also have to include in the MAH field the EV code of the new marketing authorization holder. And that way you will invalidate the product, letting us know that we are expecting to have a new authorized medicinal product entry submitted by this particular marketing authorization holder, reflecting that the MA has been transferred to them. Again, this is a standard process. The only thing that has changed now in the process that was in use for many, many years is that the old MAH needs to reference in the medicinal product entry that they are invalidating the new MAH. Is there a need to then harmonize Module 3 and SMPC? Marcos?
Well, ideally, they should be harmonized and we should have the same data in the SMPC and in Module 3. But we know that this is not always happening. So why we have implemented now this new, like the capability for MA holders to submit the data as in Module 3 is because we have received this request from industry because they would like to provide the composition as stated is in Module 3 rather than the one that is stated in the SMPC. So we listen to you, we have implemented this new process, and therefore you can submit the composition as in Module 3. But ideally, the data should be harmonized, but this, I think, doesn't really depend on you. It's also depending on the NCAs and their willingness to also approve the composition in the SMPC as this has been stated in Module 3.
But just to be clear, EMA accepts the composition in either of them, even if inconsistent, and we are not recommending that you start doing variations tomorrow to align the composition in Module 3 or SMPC. So that's not a requirement or a recommendation from EMA. We leave it up to you. Whatever you choose, we just want you to send us the reference source of information that you use to enter the composition.
And the last update, the MAH holder, would that need to be done for products transferred in the past 2 years? The answer is no. You cannot change information in product entries which are already invalidated. So if today you need to invalidate a product record to notify transfer of MA, then yes, you need to reference the new MA holder. For anything that you invalidated in the past, you don't.
And I do understand there's more questions in Slido. We've seen them whizzing by, but the colleagues addressing them will have some time to have a look. Because I also see a lot of questions on PMS. I suggest we move along with the PMS piece, and we can always circle back to XCVMPD because these two topics are fairly related. So up to Veronica Lipucci, if you're ready.
Thank you, and good morning, everyone. So this time is the first time, I hope you can hear me correctly, is the first time that there is a PMS dedicated status update sections as part of the SPOR status update webinar. So today the goal is to provide you indeed an update on the planned activities in PMS, but also to highlight to you the progresses that we have achieved so far in 24 with a specific focus in the last quarter, so quarter one. In addition to that, I will be giving you an overview of those that are the upcoming milestones foreseen for Q1 25 and beyond the whole 2025. So this part of the presentation, of course, aims to offer you a bit more clarity on what we are progressing on, which are the activity, and a bit of the main milestones which are in the roadmap to enhance indeed our regulatory PMS data service within the PMS project. So as you can see in this slide, you might have noticed that we have used a slightly different layout and colors, which is different in comparison to my other colleagues and SPOR services. This is because, just to remind to you all, PMS is still a project, so is not yet fully implemented, as you may have noticed. And this is why we wanted to find a good balance between giving you good level of information, but also keeping an eye on the fact that we are still in the development phase. So let's start by looking at what we have planned as a PMS activities. So in terms of delivering efficient and effective regulatory data services, as you can see in Q4, but mostly all over 2024, and we plan to improve and go beyond 25, of course. We focus mostly on improving the processes for the day-to-day support for user who submits tickets via Snow ServiceNow, and these tickets are usually related to any of the PMS related questions or services or incidents that they may identify, both on API system but also at the PUI level. So depending on which system and portal are you accessing your data. We also manage the system, the ServiceNow ticket in case of request of information and documentation, and for that we plan to improve our service for over 2025. So in terms instead of the data management and data quality services, as you may have heard before, our colleagues from XCVMPD service, they have already explained what they have been doing so far, and they also plan in support of the PMS project. So our aim is, of course, to continue in providing assistance to that, not only from a PMS side, but also from an XCMPD side. Regarding the improving of the customer satisfaction and success, there are few activities which are purely project related. So the key part that we would like to highlight today is that we have been able to advance in releasing specific documentation. So for instance, in quarter four, right, close to the Christmas break, we have been able to release important chapters as an update of the EU IDMP implementation guide. I will give you more information which are the chapters involved in this release, and also the publication of the updated version of the PMS FAQ document. This document is also important. I will show you in the next slide why, but it contains update information on the data fix and data quality issues that have been identified in 24 and planned to be fixed in 25. So these documents provide essential guidance and clarification to, of course, enhance the quality and the transparency on the use of the PMS data. So moving to Q1, as you can see, we plan to publish another bunch of information and documentation. So the most awaited one is the single product enrichment guide, which is expected to be released by the end of this month. And along with that, also the right PMS API implementation guide. This is an update that comes from yesterday. It's already available on the PMS website because it was published successfully yesterday. Moving ahead over the second quarter, third quarter, or 2025, we also plan to release the data protection notice in line with the other SPOR services. This document is expected to be released in March 25. And along with that, because we are also, I will explain you soon, we are also planning to move ahead in the deployment of additional functionalities. We also plan to publish the updated guide for the bulk update process. Moving to quarter three, there are a few still awaited chapters that we aim to release. The next chapter will be chapter 4, which defines the data quality framework and the way the data can be ensured of a good quality. And in addition to that, also there is this willingness to create a data matrix Excel file that clearly explains each PMS data elements, which each PMS data elements is consumed by different systems. So you can have PLM, ESMP, EAF system for the moment that are using this data. So we aim to bring more clarity on that. In addition to that, we also aim to increase the level of awareness and visibility through hosting several webinars and workshops. So as you can see, there are a bunch of workshops that we plan, not only SPOR update webinars, but PMS dedicated webinar. You can see this based on different colors that we use to highlight the differences. So the first that we have hosted in January, right before this event, was the PMS API read-only webinar for all NCAs. Then we plan soon, and actually on the 28th of January, to host a webinar on the PUI edit functionality. So to explain close to the go-live date, which are the functionality that registered industry user can perform via accessing PUI and submitting products data in a structured way. We also do plan to host two webinars. So one actually is a webinar, the other one is a workshop. This is mostly focused for MAHs and vendors because we aim to get more clarity and engage even more with the vendors and developers of the PMS to prepare for the PMS API machine-to-machine connection for writing products data from their RIM system directly into PMS API. So before releasing such system and capability, of course, we need to deal with them and we need to engage more, as I said, to pave the way for this additional release in production. Another important event that we plan is the PMS Info Day. Most of these webinars are already published on the EMA website, so please do have a look on it. And for the matter that concerns the modernization of data and information management, you can see here that as part of our initiatives in Q4, we successfully managed to release the access to all NCAs, so in this case, human and vet or human-only NCAs, to the PMS API. And the release that we're planning is to open in Q1, so actually by the 31st of January, the possibility for MAHs to submit single products update in a structured way via PMS PUI. There is an additional milestones that also my colleagues have mentioned as part of the XCVMPD presentation, which is the process to ensure that MAH can follow in case of transfers of products data, national authorized data into XCVMPD. So these are the main milestones that we foresee for Q1. Of course, last but not least, very much awaited for most of the big pharma is the release of the bulk update via still PMS PUI for registered users. I will give you more information in the next slides. And again, the release of the write capability via PMS API for the same level of information that we plan to open in PUI. If I can have done the next slides, I will give you an overview of which has been more details, let's say, in what we have been able to achieve last quarter. So as I said, the first topic is the release of the EU IDMP implementation guide. This is a new version that was released in December 24, if I'm not mistaken, on the 17th. We updated a bunch of chapters which are key and critical for industry to be compliant and to be fully aware of which have been the progresses that we have been made in PMS. So this chapter are chapter 1 in terms of the permanent process for NCAs to register to PMS API. Chapter 2 will give you much more information regarding the business rules, the new elements or removed elements of class of elements that we have agreed so far, and also a bunch of information at the level of the label that we have implemented for those RMS leads that are supporting the PMS data structuring and entries. For what concerns chapter 3 and chapter 9, we have been also provided an update on the process for submitting soon the information in PMS, also providing full details of which are the information regarding the delta, how the data are submitted into XCVMPD and land into PMS. This is chapter 9. Regarding chapter 5, this is just an update, a minor update on the elements name and elements numbering into the Annex A to chapter 5. Regarding the FAQ updates, instead, this was also a document that was released on the same time as per the UIDMP chapters. So again, in December 24, and it provides you a deeper overview of which are the most frequent questions that we receive, clarifying activities that we have scheduled with the PMS development team to enhance the data quality, and also which are the plans to fix specific bugs and issues that we have identified in a priority-based approach, of course. So the publication basically will support a streamlined submission process. We reduce the number of errors that you see in your data when you access PMS, and will improve also the transparency and hopefully improve also your confidence when reading data. With reference to the last point, so the PMS API access for all NCAs, as I mentioned before, the NCAs, both human and operating in both human and veterinary domain, or just in human domain, can now all access authorized products data through PMS API. As I mentioned before, we were unable before to release the full access for human-only NCAs because we had to deploy a component in PMS. As you know, PMS is also a shared technology with UPD, which prevented human-only NCAs to access purely veterinary data, so to be compliant with the legal requirements. This is now available. You can access it, you can request it. You can access chapter 1 for the full permanent registration process, and hopefully this release will foster integration between a PMS database and enhance the connectivity and usability with the NCA's national database. So for us, this deliverable has been a very strong foundation to achieve more and more goals that we are planned to release in this quarter. I will show you soon why, but just to summarize for us, 24, not only quarter one, but the whole 2024 for the PMS team has been really the year of the release and into production. So we would like to thank very much all the external stakeholders and also internal colleagues from SPOR team, but also other teams that have been made an extra mile and an effort to make this possible. So a big thanks goes to all of you. Now, moving forwards to the focuses on quarter one 2025, if I can have the next slide, thank you. I will just provide you an information on which are the main points. Of course, there are much more, but these are the most relevant for us. So the most awaited enrichment process for a single update in PUI. As you know, there is a need to be compliant with some legal requirement in order to support also the ESMP platform. So as of the end of January, by the 31st precisely of January, we plan to open the possibility in PUI for the marketing authorization holder on non-centrally authorized products impacted by the Union list of critical medicines to submit structured products data into PMS. It's a limited data fields, data sets of elements that we will enable to submit. Is still in a structured way, and in order to get more information, we also recommend you to join the webinar that is planned to be hosted on the 28th of January, so next week. The key improvement for the key benefit for the regulatory, for the marketing authorization holder and particularly for the users is basically to improve the operational efficiency. So by reducing the manual submission, the manual effort, you can submit data in a structured way, and you can see that this data will be consumed by consuming systems such as the ESMP. So in a way, by submitting this information, you will see this data reflected directly into your ESMP some shortage submission templates. Of course, we want to enhance the data accuracy and to make sure that you can access much more information than the one that we made available before. You know that we are opening this the PUI, this capability, because we don't have data such as manufacturing information. So you're requested to enrich this data and also to streamline the compliance from a regulatory requirement. As I said, we want to simplify the whole submission, aiming to have a seamless structured data submission and hopefully to achieve a very good quality of data. To do so, we plan also to release the navigation guide with a specific section of the single update enrichment process. So please bear with us. By the end of this month, we also release this information. Right PMS API implementation guide, last but not least, for quarter one. This is already available on the EMA port and the EMA website. So I would strongly recommend MAH user relying on developers and vendors to please contact their vendors and please request to accessing this information, review the information, because in our plan, we plan to host webinars and engage more and more with them because we want to test, of course, the system. We need to plan for this UAT with them, and we also want first to make sure that whatever we have been able to release as part of this guide is what you actually need to be in a good position of testing PMS API right. So the benefit for you, of course, is to enhance the integration between your RIM system and PMS API to support the submission of products data, again, in a structured way, but just used by using PMS API. Of course, is the key part is also to submit automated data exchange. So hopefully we can improve the compliance and also streamline the operational efficiency also with the use of the API. Moving to the last slide, yes, the last slide. What is the main highlights? So it's just summary. We have been able to release a bunch of UADMP chapters and also FAQ as updated. We have really improved consistently, but still not, we haven't yet completed this activity. The data quality of the information that you can see, Marcos and I keep an eye, of course, always on the ticket that you share with us. We try to highlight and prioritize what is the most important for data fix, and we plan for data fixes in due time for that. We cannot address all of them at the same time, so please bear with us. We keep you always posted via the PMS FAQ documents. What's the ongoing work? I'm not going to repeat much, but again, single update, implementation on the new transfer process for national authorized product to submit to allow NCAs to access their NAPS data, and also the right implementation guide, which has already been released yesterday. Future key important changes: release of the bulk update in Q2, release of the PMS API right in Q2, and in March, release of the data protection notice to secure the level of information, personal data information that are available across our system and also on the ticket that you submit. So we want to protect your privacy. PMS data quality improvement and data fixes still ongoing until we have completed what we have to address. And then in the future, we aim to release chapter 4 containing data quality framework principle and also this data matrix file. And in addition to that, moving towards a PMS Fire R5 as an upgraded version in comparison to what we have now, which is R4. And I will thank you very much for your time and attention. I'm happy to address if you have any questions.
So, Veronica, there's a few questions already on screen. We're running a little bit behind schedule, to be modest, and I still want to leave some time for the conclusion. So, I suggest maximum until 20 past. So, try to be brief in the answers so that we can cover the majority of the questions, or as much as we can.
Okay, I'll read it. So, do you want to read it?
No, you can read it yourself unless you need support from Marcos or Veronica or myself.
Okay. So, confirm my understanding, pure enrichment, single update and bulk update just for NAPS, MRP, DCP, non-centralized products, and structure manufacture details, structure pack size, and data card identifier. It's possible to specify updating timelines, plan PMS activities. So, let me go in order. Single update is going to be released as of 31st of January. You are required to submit all structured manufactured data information pack size only. Data carrier identifier information will be possible to be submitted as of Q2. We will communicate it in due time. But you are requested to submit this information if your product is impacted by the Union List of Critical Medicines. For non-centralized products, yes, we mean MRP, DCP, and national authorized procedure. While the bulk update, as I said, we aim to open it up on testing, so we need to run a UAT in Q2. And again, it's another way that you can submit products until the end of 2025 if your product is impacted by this list. So, any visibility, EMA can comment about when the edits for the CAPS product edits will be opened for the structure, manufacturer details, structure pack size, and data card identifier. So, the centralized products information, we are loading this data from SciAmet. So, for the moment, we don't need you to structure such data because we are already able to retrieve it. We will communicate in due time when we will have new edits functionality open for additional PMS data fields. So please bear with us. Thank you. Then in the new chapter 2, there is a new manufactured item, manufacturer reference new, is meant to be used for central authorized product or national authorized data enrichment, or is not in chapter 7 for century, I think it's century authorized product, or it's not really clear. So we have included this reference, and as I said, we were gonna host the 28th webinar. I will guide you through each single element, but these elements can be submitted for non-centrally authorized products as part of the data enrichment. So please bear with us. Yeah, chapter 7 has not been updated. This is planned for 2027. 2025, I need to review also the way they have been numbering and made the terms and the fields.
Sorry, Bernica, maybe I can say something here. So this new reference is in section 5 of chapter 2, which is the section of the packaged medicinal product. So this is just a new field where in the future users will have to link the package and the manufacturer item to a specific manufacturer in section 1. So it's just a link that is needed, and this is why we have included in chapter 2. This information has not been migrated, and that is why we don't have it in chapter 7. It's just a new field with a new fire path and everything. It's for the data model of PMS. It's a link between the package and the manufacturers. So maybe that can help a bit.
Thank you, Marcos. So when the product is withdrawn, but in PMS it is shown as active, how PMS handles the case? Does it update or inactive status or totally remove it from the PMS system? Because with our product, few were removed from PMS instead inactive status. So I think, Marcos, this is linked to the nullified or valid products, but
Yeah, so I can
leave it to
take
you
this
to
one
just
maybe.
withdraw status.
Yeah, so we have different status here. One is withdrawn or valid, and the other is active or inactive. So if you withdraw a product, that means that in XCVMPD you have invalidated this one. So the authorization status will change to not valid withdrawn in XCVMPD, and therefore in PMS. You should be able to see still these products or pack sizes that are withdrawn. Please make sure that in the filter you have removed the filter, because by default it's only for the valid status, authorization statuses. So if you don't remove the filter there, you will not be able to see it. Active or inactive means if the product has been nullified or not. Nullified products in PMS are not shown, the same as the nullified pack sizes. So you need to take into account these different statuses, and also the filter that you have for the authorization status.
So I think you can take also this one. The reflection of the pack size splitting in PMS is strong for multi-language countries. Is it still a non-issue? If yes, when it is programmed to be solved? Should EMEH's open ticket to correct data? Thank you.
So with this one, I will reply to multiple questions that I have seen in Slido. So yes, we know there is an issue with these multilingual countries, because for each language you need to submit an EV code. What we have is for each EV code one pack size. So let's say the pack sizes in PMS are duplicated because we have one for each language. There was another question if there is the need to submit the pack size in English for these multilingual countries. The answer is yes, because this year we want to analyze how can we merge those packages that belong to those EV codes that belong to the same package. The only difference is on the language, and we want to use the package description. So it's already stated in chapter 3.2 that this should be the case. And please don't open tickets for that, because if you go to the PMS Q&A document, this is already stated as a known issue. So there is no need to raise a ticket, because we will not be able to do anything. We are analyzing, and we will solve this issue during this year.
Can you say a few words about the PMS Right API implementation guide and specs published yesterday? So yes, if you open PMS webpage, you can access under chapter 6 two new documentations. One is the zip file, and the other one is an introductory documentation that explains to you how to access the data and also what you can find in. So just to give you an overview, these implementation guides provide, it's a zip package, and it gives you a bunch of toolkits that your developers and implementers can use to build the machine-to-machine connection between the RIM system and the PMS API. You don't have yet the token, so the secret credentials, because this is not live yet, but you can start seeing that there are many file profiles, extensions, conformance resources, documentation, technical artifacts, and in different types of format, XML, JSON. So this is very technical documentation that you can see and also review it. And a next step, what we're planning to do with our PMS industry SMEs is to contact and reach all the vendors to make sure they are all on board to be equal with everybody. Thank you.
Veronica, I'm afraid we need to move along just a little bit. We're running out of time. And I believe that we've shared a lot of information today, so I didn't want to close the webinar without concluding it a little bit, highlighting the key things that we believe that our users should focus on. So just a little bit of a recap. So you've heard a lot, and in these slides that will be available in the recording, you can always go back, circle for further details. This slide particularly summarizes what we think are the key takeaways for you today. So with regards to SMS, the things that we have achieved that are focusing on is that there's been an update to custom attributes in the SMS API. So if you use the application programming interface, you can now see refreshed data of substances used in the union list of critical medicinal products. There's also been an update to the SMS guidance, particularly with regards to information on the SMS API, how you can access it, and on the cleansing of the substances. On RMS, the key highlights of the last quarter, there's now new additional languages available in Medra, so you can improve the way that indications are coded. And we are planning to do, or we've done Medra and Vedra updates. On the OMS side, there's been updated business rules, especially real-time events, mergers, acquisitions, moving of locations, and business rule details. These are now available on the standard, on the OMS portal, on the business rules document, and we have now fully started with the registration of natural persons, so the individuals. The key highlights of today, and not surprisingly, if you look at the amount of questions we had today, are all the announcements around XCVMPD. So those are the main activities really for marketing authorization holders. For NCAs, we've launched a new product mapping services, and we have dedicated outreach to NCAs. But specifically for marketing authorization holders, please pay attention to the new transfer process, where if you're transferring a product, not only you need to invalidate it, but you need to indicate the new holder of the product. Please note that you can submit composition now either based on SMPC or based on Module 3 of the dossier, and that in specific use cases for MRP, DCP, you can submit pending products so that you can use that information for electronic application form. So these are the new highlights specifically for marketing authorization holders. On PMS, it's mostly information. The PMS API has been made available to all NCAs at the end of the year. There's updated implementation guide chapters and FAQs, and the POI enrichment for marketing authorization holders has been open since 20th of January, if I'm not mistaken, but for sure January. So key notes, the orange box over there, follow the instructions on the new MA transfer of MA process to avoid disruptions, to make sure that there's no duplicates, that you can see the products. Optionally, so this is not a recommendation, we are not saying we prefer module 3 or we prefer SMPC, choose what you want, but whatever you want to choose, align the entire composition with either module 3 or SMPC, and while doing that, we kindly request that you avoid using the substances with SVG flag 0 or even non-current terms wherever possible. The deadlines remain: submitting packages to Union list of critical medicinal products by February, and start to complete the manufacturers and structured pack sizes with the functionality that was available now from January, and the deadline for that is December. So you have about a year to complete this task. So this is the key summary that we wanted you to take away before we close shop. Next slide, just to recap, we will continue doing these webinars on a quarterly basis. The dates are there, so 9th of April, 9th of July, 8th of October, if you want to put the placeholders in your calendars. And we're still contemplating whether there is a need to do the week of webinars, because most of it is a repetition every year, but we see that as a training opportunity for users. And we're also contemplating the customer satisfaction survey, because we keep running it, and what we're seeing is that there's less appetite. So we're likely to ask you for feedback on these two events in subsequent webinars. For now, really appreciated the last 3 minutes of the webinar. If we could launch a small poll. We really appreciate your feedback on this, and I can already preempt. So I hope you enjoyed having PMS for the first time and having the view of how things connect. I am sure you would appreciate more time for questions and answers. We can extend, but I hope you also understand that, I don't know if you're aware, but I was looking at the numbers. We had over 1,000 participants at a point in time, and we have a team of I'm counting 7 people here to address them. So it is quite challenging to address the questions and the proportionality of number of people versus the questions. So do bear with us. We always see how we want to improve. So if you ask more time for questions and answers, please give us a suggestion how you think that would be feasible, considering the current circumstances. And any other suggestion, topics you want to see highlighted, documentation, please give us the feedback on the poll. So have we launched that, Miriam, the poll? So in Slido, please save the last minute, leave some feedback, and I thank you for joining for the first webinar of the year. I hope to see you throughout 2025, and looking forward to your feedback. Thank you.